We're here again with nurse practitioner Christy Marcella at a women's health office, and she is now going to talk to us about the issue of menstruation.
Yes, hi. So with menstruation, it happens as early as age 10, and there can be some girls that are older that get their periods. There's a wide range of what's considered normal or abnormal. So everybody's different with that aspect. I have found that necessarily when your mom started doesn't necessarily mean that's when you're going to start, and or the sisters. So just know that everybody is different. With menstruation, it also starts differently. Some girls may have some dark brown spotting. They may or may not have some cramping. Some may have bright red bleeding. Either of that is normal. With the dark brown, it may just mean a little spotting in your underpants. That typically is the start of a period. Typical periods last anywhere from 3 to 7 days. If you're bleeding more than 10 days at a time, you need to let your parents know, your mom know, and or your healthcare provider. The other thing is if you're having cramping. Cramping is not uncommon. Mild cramping is normal. You may have cramping in the lower abdomen. You may have some cramping in your back. I would suggest that you take Advil or ibuprofen every 6 to 8 hours, and even use a heating pad. Diet and exercise is also huge. That helps with cramping and pain. But if it doesn't get better and or it gets worse, you need to talk to your healthcare provider, because there's some things that we can do to eliminate those discomforts for you.
And so when you say cramping, we're talking like a dull ache?
Yeah, a dull ache. It should never be doubled over. In pain, you should never miss any school due to the cramping. It should never be that severe, but it is. If it is, you need to allow your provider to know that.
Okay.
So hormones are a part of a woman's body. It fluctuates throughout the month. It is estrogen, and it's testosterone and progesterone. Those are 3 hormones that are produced in women. It is produced in the ovaries, and then your adrenal glands also produce testosterone. Depending on where you are in your cycle, depends on the level of those hormones, and they will fluctuate. Some girls will get headaches with their periods. That's typically indicated by a drop in estrogen. Those are called menstrual migraines. And if that occurs, you need to let your provider to know. There are some medical medications that we can give you to help prevent those. If your periods are irregular or you're spotting in between periods, sometimes that can be a fluctuation in estrogen and or progesterone. Once again, make sure you talk to your healthcare provider about that. There are certain disease states in the women. Polycystic ovary syndrome is a big one we see, and there's a big fluctuation in hormones. May cause mood swings. That's also normal. May cause food cravings. That's also normal. What I would recommend is that you become familiar with where you are in your cycle and track it. There's wonderful apps now on your phones. You can also do a paper. Maybe the first day you start your period, that's the first day you bleed, that's day 1 of your period. Typically will last 3 to 5, sometimes 7 days. And you may start tracking that. When you ovulate, that's typically 14 days from the first day of your last period.
Okay.
With menstruation, also the other thing is when you first start your period, you may get it every month. It may take a couple years to get your body regulated. You may skip periods, but know if you're ever bleeding more than a pad per hour, and or if you're changing a tampon more than twice in an hour, you need to let your provider or your parent know so they can be contacted. Several things you can do when you get your period. One would be a pad. There's different sizes depending on how heavy your periods are. There's also at night, there's some pads that wrap around the underwear so you don't bleed into your clothes or onto the sheets. But with a pad, you just place this into the underpants. I would change this every couple hours. What can happen is if you have a lot of blood or moisture on this, it can cause some irritation. It may cause a bacterial infection, and that can cause some odor and discharge. So just make sure that you change this pad at least every hour to 2 hours, depending on how heavy your flow is.
Okay. And when you remove the dirtied pad, what should you do with it?
Okay, yeah, so first when you remove the pad, when you put the pad on, every pad has got a sticker in the back. I would remove that. This sticks then to your underpants and it doesn't move around or fall off. When you're taking your pad off, I would roll it up. I would wrap it in some toilet paper and throw it in a trash can.
Okay.
Don't ever throw these down the toilet, so it will clog the toilet.
And then some women are ready to use tampons. What's the
Yes.
advantage of a tampon?
So advantages on tampons is you don't have the pad, you don't kind of have that bulky feeling. You can also swim with a tampon, as you can't use that with a pad. With a tampon, there's several different sizes of tampons. There's also cardboard applicator and a plastic applicator. It depends on what is comfortable for you.
Okay.
Plastic applicator is a little bit more round and a little bit smoother. Most girls find that those are a little bit easier to insert. Nothing should be painful to insert, and if so, you once again need to talk to either a parent or a healthcare provider about that. With a tampon, it is placed inside the vagina. The cotton is released inside the vagina, and then you will have a string that comes out through the vagina. This is used so when you need to remove your tampon, which is no more than 6 hours. I recommend that you change it at least every 4 hours. You just pull it gently. This tampon comes out. Once again, I would wrap this in toilet paper and throw it in the trash. I wouldn't recommend that you throw it or flush it down the toilet because it can cause the toilets to become clogged.
Gotcha.
This applicator also is thrown away in the trash can. It is not flushed down the toilet.
How do they know how far to put the tampon applicator in?
So as far as is comfortable with you, that tampon is not going to go anywhere else but in the vagina. It will not be pushed up inside the uterus or inside the abdominal cavity. So as far as that's comfortable with you, when that applicator is removed, you should not be able to feel the tampon in place. If you feel the rubbing on the outside, then that tampon needs to be placed in farther.
Right, so the cotton part of the tampon should not be seen. You
No.
can't see that coming out of the
You
vagina.
should not be able to see the cotton part of the tampon.
Okay.
Yeah. One concern that I do get questioned is toxic shock syndrome. I personally have not seen that. It's not as prevalent as it has been several years prior, but it can be caused from using a tampon left in place too long and or a large super absorbent tampon. So what I would recommend is that you use a tampon, possibly a slender or regular, change it more frequently than getting a super absorbent tampon that's left in longer. But what occurs is when you do wear a tampon, super absorbent, there is a material in that tampon which has been changed since several years ago that can cause an overgrowth of a staph infection or a strep infection that gets into the system, and that's where we get toxic shock syndrome. With toxic shock syndrome, you may have a high fever, you may get a drop in blood pressure, you may have cramping and pain, you feel any of that, you need to contact your doctor immediately.
But you said nowadays they've changed the content or the materials in the tampon.
It's not as common, it's still possible, but it's not as common as it was possibly when your mother had her period or a grandmother. But yeah, what I would recommend is that you use the small absorbency of the tampon and change it frequently to reduce your risk for toxic shock syndrome.
And I know if you buy a box of tampons, there is kind of an instruction manual included about how to position your body more comfortably.
There's no wrong way to do it. I always recommend girls when they're first starting to use tampons, you can always practice using a tampon when you're not on your period. Sometimes that's a little bit more comfortable for you because you don't have the bleeding there, but you can use a tampon without your period. Just use a small, more slender, because it might be a little bit more uncomfortable taken out. It shouldn't be painful. There is a menstruation cup. I haven't been around that. I do have one patient that has used a cup. It is placed inside the vagina. It's a flexible cup that goes right over the cervix, and it does collect the flow of blood. That is taken out regularly, rinsed off, cleaned, and replaced.
Okay.
So the two most, I would say, common forms would be the tampon and or the pad.
Gotcha. Thank you for sharing some advice about coping with menstruation.
Thank you.